Hi there, and welcome back to the series for emotional regulation. I'm your host, Tom, as we go through this portfolio. And so, some of the ways that last time we talked about radical acceptance, and I hope you did okay with that. And today we're going through two more DBT techniques that sometimes just help in the moment where you're trying to accept the current condition, right? Again, we're talking about radical acceptance. We're talking about accepting it is as it is without judgment. It doesn't mean that you have to like it. It's you just accepting what it is. And so sometimes different mindfulness techniques are required. And so these are two different techniques that we haven't talked about in other sessions. One is called half smiling. And what this does is it's a bit of a mindfulness technique, but it also helps with our behaviors changing our emotions. And so what I'm going to get you to do is I'm going to get you to sit or lay down, and I just want you to try and relax. And if you're having a hard time relaxing, you can go back to one of our previous sessions in the coping skills to progressive muscle relaxation or breathing. But for now, I just want you to relax your face. And what I want you to do is I want you to let both corners of your lips go slightly up. So this isn't a big grin. If you're feeling any tension in your face at all, then it's too big of a grin. So what I want you to do is just have like the corners of your lips go up just a bit. And I want you to keep the rest of your face relaxed. And I want you to hold that for a minute. And we're going to time that. And as you're doing that, all I want you to do is just focusing on, I'm just kind of doing a little bit of a grin, just the corners of my lips, not thinking about anything else. And if you do find that your mind is wandering, just acknowledge the thought or the sensation, and yep, and then just focus on the corner of your lips going up just slightly. Okay, and there we are. So I want you to kind of take note. Do you feel any different? Do you feel better, worse, about the same? When you're finding that you're just kind of in a state where you're not being able to process things, this can be kind of an interesting little thing to just try to change your mood. And it may not change it radically, but if you're at a 7 or 8 out of 10 for feeling really dysregulated, if it gets you to 6, like a 6 is a lot more easier to deal with than an 8. So while it may not have a huge impact, chiseling away at some of that intensity makes a huge difference. So the second one that we're going to talk about, again, this is another DBT technique that we're going to review, is called willing hands. And biologically, for whatever reason, when we have our palms up, it's about acceptance, and it's about relaxing, and a little bit about submission and just giving ourselves up to something else. And so that's what willing hands is if you're standing, you can drop your arms down from your shoulders, hands turned outwards, and your fingers are relaxed, but it's palms up and out. If you're sitting like I am right now, just sitting with hands on your thighs or on an armrest, and again, having your hands, palms up. And all you're thinking about is just the palms being up and just accepting this situation in this moment. You're not thinking about anything else, just what's happening in this moment. If you're lying down, arms by your side and your palms up. Okay, so for this week, what I want you to try and do is I want you to try once of the willing hands and once of the hands half smiling. And I want you to notice how that happens and see what's kind of going on there. And from there, We're going to go into a little bit more different mindfulness techniques that we can kind of take a look at. We're going to do a couple that we haven't done before. And so these will be a little bit different. And so we're going to do all that in the next session. So thank you for tuning in, and we'll see you in the next session.